The most common excuse made by New Jersey politicians about why something isn't working is because there isn't enough funding to fix it. That's why the Pension and Health Benefits Commission noted that at least $2.8 billion in new annual taxes would be needed by 2022 to cover state obligations. Our constituents cannot afford that. We are already one of the highest taxed states in the nation. Our constituents' pockets are not inexhaustible fountains of cash. There are very few areas of our budget where we could save $2 billion or more per year. Implementing this reasonable health benefits reform package will benefit everyone, taxpayers and public workers who depend on our contributions to their pension system, with a minimal impact on those very public workers. Our failure to act on these essential reforms isn't just an economic failure. It is a moral one. The very viability of our state operations, upon which so many poor and middle class and developmentally disabled depend, is in serious and real jeopardy due to our inaction. Mark my words, there is no way to fix our looming budget challenge without these reforms. It's been 850 days since a bipartisan commission recommended health benefit reforms that would save state taxpayers billions of dollars that the governor and Republicans in the legislature have pledged to dedicate to dramatically accelerating or fully funding our pension obligation. By design, these reforms will be coupled with a constitutional amendment guaranteeing the state make its pension payments. And we only have 26 days to get this accomplished before burdening taxpayers and the state budget with another year of increased cost due to our inaction. Had these reforms been fully implemented by FY 2017, the $2 billion saved could have allowed a payment of $4.07 billion, 87% of the full pension contribution, more than double the amount we've been able to budget for this year. Yet, when the opportunity to save money that is guaranteed to be dedicated to pension funding presents itself, this legislature has failed to act. There is no good reason to hold back reforms that were drafted by impartial Democrats and Republicans in the best interest of the state. If these changes aren't made, the pension system will become insolvent and taxes will have to be increased by billions, along with drastic cuts to programs that so many depend on. Our beleaguered taxpayers who struggle every day to continue to afford to live here and pay for their own insurance, which on average is dramatically inferior to the Platinum Plus plans enjoyed by government workers, will pay the consequences. The system we have now is unsustainable, and year after year the burden grows by hundreds of millions that taxpayers simply cannot afford. Reforming our very generous health benefit program is the only realistic way to increase pension funding by billions of dollars. If we fail to reform health benefits, we are jeopardizing the pension system and the promise to all vested workers that their retirement benefits will be secure, and doom ourselves to drastic cuts in services and dramatically higher taxes. I urge the legislature to pass Assembly Bill 3905 with the Pension Review Commission's recommended amendments that help lower-income retirees pay their premium.